Hello, and welcome to our Pre-Advocacy Day webinar, designed to help all of you learn about the issues that we'll be talking about during Advocacy Day and during your meetings with your state representatives. My name is Adam Miller, and I'm the Communications and Member Services Coordinator here at the OPTA. We'll be hearing more about some of these issues at Advocacy Day itself, so the purpose of this webinar is to help you become more familiar with some of the issues, how to meet with your representatives, and key talking points. So let's get started. Let's get started by talking about your meetings with legislators. The agenda for Advocacy Day is now posted online, and you should be receiving it electronically as well. The agenda includes presentations on issues and State House information in the morning, lunch with legislators, and then meetings with your legislators in their respective offices. Some of you have met with your legislators before, but many have not, so here are some important things to remember. First, they want to talk to you. You've all provided your voting addresses when you RSVP'd for Advocacy Day, so they know that you are in fact a constituent. They want to know you. 2. Although you need to know the basic facts about the issues you discuss, you are not expected to be an expert on legislative details. You will be most effective when you speak from your own personal experience as a PT, PTA, student, or educator, and as an active member and voting citizen. 3. If you have your DPT, introduce yourself to your legislator as doctor. If you haven't graduated, explain your level of education, because your legislator may not know that all PT schools in Ohio educate to the doctoral level. Explain what courses you take, and how your terminal degree prepares you as a subject matter expert in your practice area. 4. Be honest with your legislator while remaining cordial and polite. Though you may not have the same political views as your legislator, you're here to represent something larger than your personal opinions today, the views of the OPTA and the profession as a whole. You'll be most effective in a very personable and tactful approach. Finally, bring business cards if you have them, and thank your legislator or his or her aide for taking the time to meet with you. It is a very busy time for everybody at the State House right now, so let them know that we really appreciate them taking their time to meet. A few more tips for your meetings. Be brief. Your time is limited, so make the most of it. Be informative. Make sure that your representative or senator understands the situation you're referring to. Personal anecdotes about your practice, program, etc. can help make your point and will be remembered much more vividly than political or industry jargon. Be accurate. Know your facts, your strongest weapon. If you don't have an answer, don't guess, but promise to provide him or her with an answer later and then follow up accordingly. Also, students will be paired with PTs and PTAs experienced with these meetings, so don't worry students, you won't be going into these meetings on your own. Lastly, as we go through the issues, remember that we will be providing you with materials to give to your legislators later on. Now that everybody knows how to approach their meetings, let's talk about the issues. There are plenty of issues that the OPTA is following closely and has a vested interest in. But for simplicity's sake, we'll be focusing on the two that are gaining the most traction, Senate Bill 233 and House Bill 143. The OPTA strongly supports legislation that would improve patient access to physical therapy services in Ohio. Currently, patients in need of essential physical therapy services pay specialist copayment amounts each time that they visit their physical therapy provider. This means that patients could pay multiple times per week for several weeks in a row due to the unique episodic nature of physical therapy services. Copayments for specialty services in Ohio vary depending on the insurer and on the plan, and can range as high as $65 per PT visit, which could add up to hundreds of dollars just to restore functionality. It's important to remember that this is a consumer-first issue and needs to be presented as such. It really is about patients who are already insured and are unable to afford their own care. And then, from a physical therapist's perspective, we aren't able to be as effective as we need to be with our patients simply because they're not coming in. Unfortunately, the trend of high copayments for PT as a barrier to services is prevalent in other states as well. But the good news is that in other states, and we hope soon Ohio, legislation is being passed to help address this barrier to care. On March 16, 2011, Kentucky's governor signed Senate Bill 112 into law, which restricts copayments for PT and occupational therapy services from being higher than those for physician or osteopath office visits. Other states, including New York, Pennsylvania, and Missouri, are also following suit. As for Ohio, our patient access legislation, Senate Bill 233, was introduced in November 2011. This legislation, in summation, would prevent physical therapy and occupational therapy copayments from exceeding the copays of primary care physicians. Proponent and opponent hearings have not yet been slated but are expected in the coming months. As a member-driven action center, the OPTA has prepared an online cache of template letters to legislators and key talking points regarding Senate Bill 233. This is available at www.ohiopt.org under legislation. Here are some talking points to tell your legislators when you meet with them. High copayments for PT is a barrier to PT services for a number of reasons. PT services are unique because they are episodic. They therefore do not fit within the high specialty rates meant to be paid only once in a while. While copayments in the amount of $10 to $20 do not increase or decrease the utilization of multiple physical therapy visits, copayments $40 or higher that are repeated multiple times a week over many weeks no doubt prohibit patients from seeking treatment. Patients who need to restore function or mobility cannot seek their needed treatment because high cost prohibits them from doing so. Patients then self-limit themselves by restricting or discontinuing their treatment, even if the plan of care says otherwise, which only increases the patient's chances of re-injury or having to start the PT program over again in the future. PT services are cost-effective. Increased utilization of physical therapy services helps save costs by preventing disability, surgery, and patient medication in the long run. In these difficult economic times, high copayments restricting patient access to services that could prevent long-term spending later in life simply doesn't make sense. What's really going on with high copayments is cost shifting to the patient. The practice of treating PTs as, quote, specialists has allowed healthcare payers to require consumers to pay the entire or nearly the entire cost of PT care. OPTA supports legislation that protects patients from excessively high copayments and essentially bearing the entire cost of the services. Also, as a private practitioner, you could also discuss the administrative burdens that your practice faces because of copayments higher than the reimbursement rates. In addition to the high copay issue, you may also choose to talk with your representative about several other pieces of legislation currently being considered by the legislature. These bills, though not proposed by the OPTA, do address issues that affect our profession, and you should feel free to discuss these as well. Particularly, if you will be visiting any of the sponsors of these bills, be sure to let them know that we support their issue. The first is House Bill 143, which was introduced in March 2011 by two Democratic freshmen at the time representatives, Representative Stinziano from Columbus and Representative O'Brien from Brookfield. The bill would require young athletes and their parents to be educated about the harmful effects of concussions and require athletes to be removed from play if they are suspected of having a head injury. Under this bill, these young athletes would be allowed to return to play only after being cleared by a licensed healthcare provider. Representatives of the OPTA have been working closely with OPTA members, the APTA, and the bill sponsors to ensure that physical therapists are added to the list of providers who can make return-to-play decisions. This bill just had a hearing on April 18th and was attended by OPTA staff and lobbyists, and OPTA member Dr. John DeWitt testified on its behalf. As hearings such as this appear on legislative itinerary, the OPTA will continue to petition members for assistance in delivering supporting testimony. So stay informed, contact your legislators, and ask us how to get involved with OPTA advocacy initiatives. Here are some talking points to tell your representative if you'd like to discuss this bill. OPTA is supportive of legislation that protects young athletes and educates them on head injuries, but physical therapists should also be included on the list of, quote, licensed healthcare providers who can make return-to-play decisions. Physical therapists are highly educated, trained medical providers and play an integral role in the multidisciplinary team of providers who can identify and treat concussions. If the bill does not include physical therapists, some of the more rural school districts in Ohio may suffer because under the way the bill is currently written, they would not have enough available providers to cover those school districts in games. Adding PTs would add available providers and help those districts as well. For more information about any of these issues, please contact us at opt@ohiopt.org or at 614-855-4109. We will go over these issues and more during our Advocacy Day programming. We want you to feel as comfortable as possible talking with your legislators, first and foremost about high copays in the treatment of concussions, and secondly about any of these other issues if you so choose. Most importantly, remember that this is your opportunity to let your legislator get to know a physical therapist assistant, or student in his or her district. Additionally, we will be providing you, or others who share your appointment time, with a folder of information for each legislator labeled with the name and district of the legislator for whom it is intended. This folder will include information about high copays and about the physical therapy profession as a whole. This information should help you talk about PT and the challenges facing our industry and patients alike. After your visit, please return to our debriefing center and drop off your visit report forms and pick up thank you cards to send to whomever you met with. Thanks again, and we'll see you on the 1st.